Hello and welcome back to Questions from Quarantine. I'm Tara Tyrell and I'm here with Dr. Margaret Bourdeaux and Juliette Kayyem, both of the Belfer Center at the Harvard Kennedy School. Our first question this week goes to Dr. Bourdeaux. We received a question from a viewer in Massachusetts who tested positive for COVID but was not contacted by anyone for contact tracing. Dr. Bourdeaux, I know you've also written recently on the breakdown at testing sites. Do you mind expanding on this a little bit and what it means for our systems?
I know I've been somewhat of a bad news person on this show, and that trend is not going to stop today. We're just in tremendous trouble, and really where we are struggling as a nation is that the very first step of contact tracing is being able to identify who is infected. And as cases have risen across the country, it has put enormous strain on our testing system. So the two big companies that are sort of the backbone of our testing system are Quest and LabCorp. And they've now announced that they can't turn around results in less than 7 days. So that means two things. One, it means that you can't contact trace effectively. And two, it means that you don't have eyes on the epidemic. So even in places like Massachusetts, we're not going to have the ability to be able to see when there's outbreaks in some places in the state where all testing is run through Quest and LabCorp. Now, it sounds like the person who had the experience did get a test that was confirmed positive for COVID, and it would have been entered into MAVEN, that's the public health database of record. And from that point, it should have gone over into a contact tracing database so that she would be contacted and that she would be asked to describe who she may have exposed. I do just want to comment on how that works in Massachusetts. So Massachusetts is one of the few states that organizes their local boards of health by municipality and town. That means we have 351 local boards of health, and each one of those local boards of health has a contact tracing program. And so what the Baker administration did is, as cases were rising, they had a group, Partners in Health, that I do some advising for, come in and graft on capabilities onto those local boards of health that requested it. And so the hope was that we would have, a very robust contact tracing system where as soon as somebody was infected, they would be turned over to a case investigator and a contact tracer. I don't know why that hasn't happened in this particular case. It absolutely should have. In terms of the internal numbers that we're seeing 95% of cases are being investigated. So it comes down to kind of where she is in the state and which local board of health is responsible for, assigning a contact tracer. And I think it's a very reasonable question to ask of her local leadership why she didn't get a call.
Margaret, I just wanted to add one thing so that like the breakdown of what is happening right now and the magnitude of it, I don't need to tell people that this is bad. And it's impacting everything from our capability to test and trace, to the PPE supply chain, to, of course, the question if we're going to open schools. If we had done this right, the question of opening schools would not be whether, it would be how. And I am, anyway, my thoughts on that are well known. But I will say one thing. What people have to realize is how the total failure to contain this virus and to prioritize containment has directly resulted in the breakdown of the tracing system. There's just too many people to trace now. And so even though in Massachusetts we can have a vigorous system because our numbers are lower, the idea of a national tracking system with the numbers that we have is it can't work, because we now are back into, if I describe what Margaret does as the sort of, individualized sort of assessment of patients, the medical approach. What I do is like the bulk, right? You just like, you tend not to have time for people, and it's like you're moving things around and stuff. We're back in bulk, right? Which is everyone wear masks, everyone back inside, close the schools, close the bars. It's ridiculous. We're 6 months into this thing. Anyway, that's my rant. Thank you. I haven't ranted.
Yeah, I would also just to say, in some ways, I feel like we do have a lot of capability even to scale contact tracing, but none of that matters if you can't actually do a test and find out who's positive. It doesn't matter. The whole issue of how many contact tracers you need, whether you can do an individual, untangling of the transmission chains. Who even cares? You don't have a positive result. That's it. We're dead in the water. And so, the moment, I mean, I would say, we are looking at the abyss. We are going to lose our economy. We're going to lose our schools. And that's what's at risk here. And that is, and we don't have leadership that's even at the ball game and trying to fix it. They're trying to figure out why they can't and blame somebody else. So we're in a very, very dangerous moment.
Yeah, and trying to save the economy, right, and opening up, we've lost both wars. The recession to come is going to be worse because there's no control of no plan. And I saw a tweet which I thought was perfect, which someone, I think a reporter, got tested and said, the good news is that I'm negative for the virus. The bad news is I was negative 9 days ago. Like, in other words, like, how is this helpful, right? As of 9 days ago.
Well, thank you for your question, viewer. We wish we had some less dire news for you. We promise the next episode this week will be a little more fun. But as always, this has been Questions from Quarantine. Thank you so much for watching.